Hi, my name is Hira, and today I'll be talking to you about Bordetella pertussis. Some background information about Bordetella pertussis is that another name for it is whooping cough because the constant coughing sounds like a whoop, and that's how I got the name of whooping cough. It is mainly a childhood respiratory disease, but it can also occur in adults. It was a major cause of childhood mortality in the U.S. back in the 20th century. The structure of the Bordetella is small, it's gram-negative, it's fastidious, it's aerobic cocobacilli. It is rod-shaped bacteria because it is gram-negative. Some virulence factors are that of hemolysin, adenylate cyclase toxin, filamentous hemagglutinin, pertussis toxin, which is also considered an exotoxin. Both the pertussis and adenylate cyclase toxin play a major role in the suppression and modulation of host immune and inflammatory responses. Some toxicities are that there are local damage to the cilia of the epithelial cells, inflammation of the respiratory tract because of the reoccurring coughing. It causes inflammation. It is a prolonged illness. There is constant coughing, which is also can occur as a wheezing sound. Interference of the normal pathophysiology in humans. Some things that can occur are vomiting because of the constant coughing and you are not able to keep down everything. Dehydration because the mouth gets dry because of the constant coughing. Malnutrition, which also kind of correlates to vomiting because you can't keep down everything that you eat. Some more severe cases are pneumonia, seizures if it's really severe, and brain damage. The populations at most risks are low socioeconomic areas. An example is a third world country in Pakistan. It can also have poorly run clinics, poor vaccine quality, unavailability of laboratory diagnostic facilities, and the pollution. If the air is not clean, that's just making things worse for the person that's coughing constantly and can just add to that. So an example of a study was taken in Pakistan, and there's two cities that were studied. It was Islamabad and Rawalpindi, and it looked like almost 90% of the people were able to get this disease, but they didn't have it yet, but they were tested for it, and so that means it has a high number of people that can receive this disease, so it's kind of alarming because of the air pollution and how sometimes not clean and they have poorly run clinics. A treatment is one of the vaccines is called Tdap, and that is for children that are under 7 years old. There are 5 doses of this vaccine. One is when you're at 2 months old, then there's another one at 4 months, there's another one at 6 months, another one's at 15 to 18 months, and the next one, the last dosage is 4 to 6 years. You need to get the last dosage. The Tdap vaccine is the adult version of the vaccine. And both these vaccines help with taking care of tetanus, diphtheria, and pertussis, the whooping cough. Another treatment is antibiotics. This only helps if you're in the early stages of the infection, about before 4 weeks. The effectiveness of treatments. So pregnant women should receive the Tdap vaccine during their pregnancy. It does help the infants the infants are less likely to develop pertussis during their first few critical months of life. Infants will gain the pertussis antibodies during their most vulnerable time, which is before 3 months of age. So it's highly recommended that pregnant women take this during their pregnancy. And not many pregnant women know that because they're not educated about it, but this will definitely help prevent more infants getting it because it is a childhood disease mainly. The effectiveness of treatment of the Tdap is that there are fewer episodes of coughing, it's shorter illnesses, and if people get this vaccine, the adults, then they're less likely to suffer from disease complications. Effectiveness of treatments for the antibiotics. Some examples that I'm going to tell you are about erythromycin and azithromycin. Erythromycin, a full dose is for 14 days. Patients have to be from ages 6 months and older. If you're under 6 months, you are not allowed to take this antibiotic. It's not safe. Azithromycin is safe for infants that are under 1 month. This is the only antibiotic that's actually safe for this age group, and the dosage is about for 5 days. A treatment plan that there was a study taken, and it said that intravenous pertussis immunoglobulin can be injected in the body, and these are the results. High levels of pertussis toxin antibodies, high pertussis toxin antibody titers in the infants, and there's a decline in coughing, which means that this is helpful for them when you inject it. Prevention, the main thing is getting vaccinated, because if people are more educated about the vaccination, then there'll be a decline in it. The antibiotics, if you're in the early stages, about 3 to 4 weeks, if you already have the infection. No close contact with carriers. Some examples are sharing toys, direct exposure, face-to-face contact, or being in a confined space with them for more than an hour, then you can prevent this from happening. Another example is if kids do have it, then they should not go to school, because they're going to be in confined spaces with the carriers, and it's not going to be good for the classroom that they're in, even for the teacher. And these are all really easy steps to just keep them home. So main prevention is healthy habits. So washing hands, covering your mouth when coughing, and staying home when you're actually sick can help prevent this infection from happening. If people are more educated about, helping kids understand this is how you should wash your hands, it should be about the alphabet song, then kids will be more alert to like, oh, I need to wash my hands, and it'll be fun for them, as well as be helpful for everybody else for this, to prevent this. Thank you.